Ozempic, Mounjaro, Wegovy. You've probably heard these names by now. They're on the news, on social media, your neighbor is talking about them, maybe even your doctor brought them up at your last visit. And there's a reason for all this attention. A major study, one of the biggest ever done on heart health, found that one of these medications cut the risk of heart attacks, strokes, and dying from heart disease by 20%. That's not a small number. That's 1 in 5 people who were protected. But here's what worries me. Most of the information you find online about these drugs talks about them as if they work the same way for everybody. And that's simply not true. If you're over 60, your body handles these medications differently. There are real benefits, but there are also real risks that almost nobody is talking about. And that's exactly what we're going to cover today. My name is Dr. John Reed. I'm an AI health presenter, and this is Senior Wellness Secrets, the channel where we take complicated medical research and explain it in plain language, so you can have better conversations with your doctor and make better decisions about your health. Everything I'm going to share today comes from published medical studies. You'll find every single source linked in the description below, so you can check them yourself or show them to your doctor. If this kind of honest, no-nonsense information is what you've been looking for, hit that like button. It helps more people like you find this video. Before we get into the good and the bad, let's understand what these medications actually do. And I promise, no medical school required. Here's the simple version. Every time you eat a meal, your gut releases a natural hormone. Think of it like a little messenger that does 3 jobs. Job number 1. It tells your pancreas to release insulin, which brings your blood sugar down. Job number 2. It sends a signal to your brain that says, hey, you're full, you can stop eating now. And job number 3. It slows down how fast your stomach empties, so the sugar from your food enters your blood gradually instead of all at once. Pretty clever system, right? The problem is, when you have type 2 diabetes, this messenger doesn't work like it should. It's like having a postal worker who keeps losing half the mail. That's where Ozempic and Mounjaro come in. These medications are like hiring a brand new, super efficient messenger to do the job your body can't do on its own anymore. 1 injection a week and this new messenger gets to work. Now there is a difference between the two. Ozempic works with 1 messenger. Mounjaro works with 2. Think of it like this. Ozempic sends 1 delivery person to your door. Mounjaro sends 2, working together so they get more done. Both are powerful. Both are effective. But they work in slightly different ways. And that matters when it comes to choosing which one is right for you. We'll compare them later in the video. Alright, let's start with the good news. And honestly, the good news is really, really good. Benefit number 1. These medications protect your heart. And I'm not saying that based on opinions or theories. I'm saying it based on one of the largest heart studies ever done. More than 17,000 patients published in the most respected medical journal in the world. The results showed that people taking semaglutide, the ingredient in Ozempic, had 20% fewer heart attacks, strokes, and deaths from heart disease. And this was so convincing that the FDA, the agency that approves medications in the United States, officially approved it for heart protection. That had never happened before with this type of drug. And Mounjaro. A large study published just recently showed that its ingredient, tirzepatide, was at least as good for heart protection, with signs that it might even reduce the overall risk of dying. The research is still ongoing, but the early results are very promising. Benefit number 2, they protect your kidneys. Now, if you have diabetes, your doctor has probably talked to you about your kidneys at some point. Kidney disease is one of the most common and most serious complications of diabetes, especially as we get older. A major study published in 2024 showed that semaglutide significantly slowed down kidney damage in people with type 2 diabetes. In plain English, fewer people needed dialysis, fewer people needed transplants. Their kidneys kept working longer. And I want you to think about what that really means for your daily life. It means more years where you can eat what you enjoy. More years where you're not tied to a dialysis machine 3 times a week. More years of freedom. Benefit number 3, excellent blood sugar control. Studies have looked specifically at patients over 65 and found that these medications lower blood sugar just as well in older adults as they do in younger people. Your age doesn't make them less effective, but, and please listen carefully to this but, just because they work well doesn't mean they're right for everyone. And that brings us to the part of this video that most people on the internet skip over: the risks. Now, we get to the part that I really want you to pay attention to, because this is what makes the difference between these medications helping you and these medications hurting you. Risk number 1, and this is the big one: losing muscle. Let me explain why this is so important. After the age of 60, your body is already losing muscle every single year. It's a natural part of aging. You lose a little bit of strength, a little bit of balance, a little bit of the ability to catch yourself if you trip. Diabetes makes this worse. And now, research published this year found that these medications can speed up that muscle loss even more. So think about it. You're losing muscle from aging. You're losing more from diabetes. And now the medication adds a third layer on top. What does that mean in real life? It means a higher chance of falls, a higher chance of breaking a hip, a higher chance of losing the ability to live independently. And here's the cruel irony: muscle is actually one of the best tools your body has for controlling blood sugar. So losing muscle can actually make your diabetes harder to manage over time. It's a vicious cycle. Risk number 2, stomach problems that hit harder when you're older. The most common side effects of these drugs are nausea, vomiting, and diarrhea. Now, if you're 35, that's unpleasant but manageable. If you're 75, it can land you in the hospital. Why? Because when an older person can't keep food or water down for a few days, dehydration happens fast, and dehydration in a senior can lead to confusion, kidney damage, and dangerous drops in blood pressure. A study looking at patients over 75 found that they were significantly more likely to stop taking these medications because the side effects were just too much. Risk number 3, the medication mix. Here's something most people don't think about. If you're over 60 and have diabetes, chances are you're taking not just 1 or 2 medications, but 5, 6, maybe 7 or more. Blood pressure pills, cholesterol medication, maybe a blood thinner, maybe something for your joints. These new drugs slow down how fast your stomach processes food, and that can change how your other medications get absorbed. Some might work less, some might work too much, and if you're already taking insulin or certain diabetes pills, adding one of these on top can cause your blood sugar to drop dangerously low. That's a medical emergency, especially at home alone. The American Diabetes Association, in their most recent guidelines, actually tells doctors to simplify and reduce medications in older patients before adding anything new. That's how seriously they take this. And to really drive this home, let me tell you about a real patient. This case was presented at a major medical conference in 2024 by doctors from the Cleveland Clinic, one of the top hospitals in the world. An 86-year-old woman. She had dementia, type 2 diabetes, and was overweight. For years, her diabetes had been well controlled with regular pills. Nothing fancy, nothing complicated. It was working. Then she had a back problem and needed steroids, which raised her blood sugar. Her specialist decided to start her on semaglutide, the same ingredient as Ozempic. Here's where things went wrong. Most of her checkups were done over video calls. She couldn't stand on a scale by herself. Her family reported how she was doing, but they didn't have the full picture. The doctor kept increasing the dose based on incomplete information. 6 months later, she was rushed to the emergency room. She was confused, severely dehydrated, had lost 28 pounds, and her kidneys were failing. Now, I want to be very clear about something. The lesson here is not that the medication is bad. The medication can be wonderful. The lesson is that the monitoring wasn't right. A powerful tool, without proper supervision, can cause real harm, especially in someone who is older and more vulnerable. All right, this is the question everyone wants answered. Ozempic or Mounjaro? Which one wins? And the honest answer is, it depends on you. But let me give you the facts so you can understand the differences. When it comes to weight loss, Mounjaro is clearly stronger. In a head-to-head study, people on Mounjaro lost about 21% of their body weight, compared to about 14% on Ozempic. That's a big difference. But when it comes to protecting your heart, Ozempic has the edge right now. It has the strongest evidence from the largest study. Mounjaro is catching up, but it's not there yet. For blood sugar control, both are excellent. Mounjaro has a slight advantage in the studies, but both bring your numbers down significantly. When it comes to safety, they have similar side effects, mostly stomach-related. But Ozempic has been around longer, so doctors have more experience with it and more data on long-term use. And here's the key point for anyone watching this who's over 60. Ozempic has been studied more in people your age. Mounjaro still needs more research, specifically in older adults. So there's no single winner. The best medication is the one that fits your body, your health history, and your goals. And that's a decision you make together with your doctor. Now, I want to talk about something that could change how your next doctor's appointment goes. Because most patients over 60 walk into that office and make the same mistake, and I see it over and over again. They stay silent. The doctor prescribes something. They nod. They pick up the medication at the pharmacy. They go home. And they never ask the one question that could change everything. That question is simple. Doctor, is the benefit of this specific drug worth the risk for someone my age, with my health history? You see, your doctor might have 15 minutes with you, maybe less. They're looking at your lab results, your blood sugar numbers, the guidelines on their screen, but they might not be thinking about the fact that you live alone, that you had a fall last winter, that you've been eating less lately, that you're already taking 6 other pills every morning. And those details? Those are exactly the details that decide whether this medication is going to help you or put you at risk. Let me tell you what the smartest patients do. They don't just sit and listen, they participate. They walk in and say something like, "Doctor, I've heard that these medications can cause muscle loss. Given my age, should we keep an eye on that? Should I be doing some kind of exercise? Do I need to eat more protein?" And just like that, the whole conversation changes. The doctor is no longer just treating a number on a chart. The doctor is treating you. Or they say, "I'm already taking 7 pills a day. Could this new one cause problems with any of them? Is there something we could remove first?" That one sentence could prevent a trip to the emergency room. Or they ask, "What should I watch for at home? If I start losing weight too fast or I can't keep food down, what's my plan? When should I call you?" Now you have a safety net. Now you're prepared. Instead of finding out something is wrong in the ER like that 86-year-old patient we talked about, you catch it early at home. I'm not telling you to argue with your doctor. I'm telling you to help your doctor. Because the best results don't come from a doctor giving orders and a patient following silently. They come from 2 people working together to make the best decision for one person. You. Be the patient who shows up prepared. Not the one who goes home with questions they were too afraid to ask. And if this part of the video made you think of someone you love, a parent, a spouse, a friend, please share it with them. Because someone out there is about to walk into that appointment, stay silent, and miss the chance to protect themselves. Let me wrap up everything we covered today in 4 simple points. Number 1. Ozempic and Mounjaro are remarkable medications. The science is solid. They protect your heart, they protect your kidneys, they control your blood sugar, and they help with weight. This is not hype. This is proven. Number 2. But if you're over 60, there are real risks. Muscle loss, dehydration from stomach side effects, and dangerous interactions with your other medications. These risks don't mean you shouldn't take them. They mean you need to be monitored carefully. Number 3. Never ever start, change, or stop one of these medications on your own. That decision belongs to you and your doctor, together. What this video gives you is the knowledge to be an active part of that decision. And number 4. If you are on one of these medications or you're about to start, talk to your doctor about exercise and protein. Specifically, resistance exercise. Even simple things like standing up from a chair without using your hands, using a resistance band, or light weights. This is not optional. This is essential to protect your muscles while you're on these drugs. And one more thing, I want to be completely upfront with you. This video is strictly educational. It is not medical advice. I am an AI presenter sharing published research to help you understand your options. Nothing I've said here replaces a conversation with your own doctor who knows your body, your history, and your needs. Always consult your healthcare provider. If this video helped you understand these medications a little better, I'd love it if you did 3 things. First, hit that like button. I know it seems small, but every like tells YouTube to show this video to more people who need it. Second, subscribe and tap the bell. Every week, we break down important health topics in plain language, so you always know what's really going on with your health. And third, this is the most important one. Share this video with someone you care about. Send it to your son, your daughter, your spouse, your friend at church. Because someone in your life is taking one of these medications right now and doesn't have the information we just covered. Next week, we're going to talk about diabetes and dementia, the connection nobody told you about. You won't want to miss it. I'm Dr. John Reed, and this has been Senior Wellness Secrets. Take good care of yourself, and I'll see you in the next one.